How to tell if you've got PTSD. PTSD stands for post-traumatic stress disorder. It's a debilitating mental health problem that can occur after you've experienced one or multiple traumas. There are certain criteria that you must fulfill in order to have PTSD. And it's important to understand if you have PTSD or not, because there are treatments that can be very effective that won't work if you haven't got PTSD. So the first thing is you need to have experienced a traumatic event. That's an event that was so overwhelming or threatening that you thought you might die or someone else might die, or your bodily integrity was threatened. Examples can include but aren't limited to being in a car accident, being attacked, being assaulted, being the victim of domestic abuse. It can also include childhood traumatic events such as childhood abuse, and experiences in the workplace such as being in the military and being a responder, for example, in the ambulance service or the fire service, and seeing repeated traumatic things. So the first thing is you've experienced a traumatic event or multiple traumatic event. The next thing is you need to be what we call re-experiencing the memories. So the memories need to be coming back as if the experience was happening again. So it's different to ruminating and thinking about it on purpose. A flashback or a re-experiencing is when the memory just comes back out of the blue. That might come back as something called a flashback, which is when you're awake and you get an image. But it might be an image or a video or a sound or a smell or another sensory experience related to that traumatic event. But it might also be in nightmares. So when you dream and have horrible nightmares about the traumatic event. So the first thing is you need to have experienced a traumatic event. The second thing is you need to be having regular re-experiencing symptoms. The third thing is you need to be avoiding. So avoiding things that might cause the re-experiencing symptoms. For example, if you've been in a car accident, you might avoid being in a car, or you might avoid going on certain roads, because if you do, the memories come back and it makes you feel very frightened. But also if you do, you're scared that the thing might happen again. The third thing is hypervigilance. So that's when you're on edge and easily startled and quite jumpy. So you're kind of always looking around for danger. You're trying to find out what the dangers are around you and kind of on edge. You can't settle. You're very scared. Often you can't sleep, both because of the nightmares, but just because you're very on edge. Also, when a trauma happens, the way you think about yourself, the world, your future, and other people can change. So your beliefs can be really ruptured by that traumatic event or those multiple traumatic events. So the world can feel really dangerous. You might have negative beliefs about yourself. You might find it difficult to trust other people because of what's happened. If you want to find out if you have post-traumatic stress disorder, it's important to talk to a healthcare professional, a therapist who works with it, or your GP, and they can help you understand if it is likely to be something you're experiencing, and then talk to you about the treatment options that they can provide. Thank you for listening.